So, Chris, thank you very much for your email. Chris emailed me from Syracuse, New York, all the way up north. We're getting all these emails from the north part of the country. And Chris wanted to know he has been wearing dentures for a while, over 20 years, and he recently has experienced looseness of the dentures. So he wanted to know, what would be my advice? What are the options that he has? And Chris, well, let me tell you a couple of things first. Uh, Maybe your denture is an old denture. Maybe your denture's been in place now for 5, 10, 15 years. And maybe just getting a new denture based on the residual bone and tissue that you have in your mouth, maybe just getting a new denture will improve some retention, resistance, and support with the new prosthesis. But I do want you to know, and you probably have heard of dental implants. And dental implants are just a titanium screw that is literally, by surgical means, screwed into the bone, and it definitely helps with retention and stability of the prosthesis. Now, how many of these implants do you think you're going to need? Well, for the mandibular arch, 2 are good enough. Now, if you can have 4 placed, you probably have a much better result. But 2 are enough. For the upper arch, if you're a dentalist in both upper and lower arch, and that is my understanding, for the upper arch, if you have enough bone, again, 4 to 6 implants is the ideal. 4 being the minimum, 6 being the best option or the ideal. Again, it all comes down to finances. If you add the number of implants and the number of surgical procedures and the cost associated with them and having to fabricate new dentures, this can be a little bit pricey, but you can always start. If you're happy with the upper denture, and normally, there's a good number of patients that are very satisfied with the upper denture, and they're more unsatisfied with the lower denture. If that is the case, why don't you start with the lower denture? 2 implants and a new over denture, that's what we call them, may help you solve your problem. After that, if you feel that there's still more retention needed on the upper denture, you can go for the option of having either 4 or 6 implants on the upper denture and still fabricate a new called over denture. The good thing I want you to know is that if you start out having 2 new dentures, one upper and one lower, and you decide only to go with the lower implants for a lower over denture, the upper denture can be modified chairside by your dentist at the time of the new implants being placed and being ready to be restored. So again, thank you very much, Chris, for your email. I hope that my answer helps you and helps others listening to this answer. And again, anybody out there that wants to reach out to me with any questions you may have related to dentistry, I'll be more than happy to give you my 5 cents of advice and any insights that I may have on a specific topic. Thank you very much, and see you next time.